So I will turn it to Senator Hassan.
Well, thank you, Madam Chair and Ranking Member Burr. Welcome, Attorney General Becerra. Thank you for being here today, for your interest in service, and thank you to your family, too, because this is a family commitment, so we deeply appreciate your service. I want to start with talking to you about the opioid epidemic. As you know, it has devastated communities all across my state. Since 2017, I've worked with colleagues to secure billions of dollars in state opioid response grants, including more than $86 billion for New Hampshire. This funding has enabled states to expand access to life-saving treatment and services for those struggling with substance misuse. And we're finally beginning to see results with death rates decreasing. But I am deeply concerned that hard-won progress is in jeopardy because the hardest-hit states, including New Hampshire, are at serious risk of a dramatic cut in state opioid response grant levels under the program's current funding formula. So, Mr. Becerra, if confirmed, will you commit to working with me and the Substance Abuse and Mental Health Services Administration, SAMHSA, to ensure that states do not experience a dramatic cut in state opioid response grant funding, a cut that could jeopardize our efforts to turn the tide on the opioid epidemic?
Senator, absolutely, you have that commitment.
Well, thank you. I want to turn now to another issue connected to substance misuse. As you know, one major hurdle that keeps people who have substance use disorder from accessing the support and treatment that they need is the existence of the so-called X waiver, the requirement that doctors who want to prescribe medication-assisted treatment receive a waiver, or essentially permission, in order to prescribe buprenorphine. This waiver limits the number of medical professionals who are able to prescribe this treatment, even though it's considered the gold standard in medication-assisted treatment. The waiver requirement does not improve patient safety, but it does limit access to care. About 40% of counties across the United States lack a waivered practitioner who is able to provide this treatment. Senator Murkowski and I plan to reintroduce our bipartisan MAT Act, which would eliminate the burdensome waiver requirement. We also sent a letter to President Biden inviting him to work with our bipartisan group of senators and representatives on this issue, and we're encouraged that he has expressed support for this change. Do you agree with President Biden about the need to eliminate this waiver, and will you commit to working with our bipartisan group on this much-needed reform?
First, thank you for the work that you and Senator Murkowski have done on this issue. As you said, President Biden is supportive of moving forward. We have a pause, as you know, on a number of these rules that are in place, but I think there's a commitment on the part of this administration to make sure we're providing that treatment that is indispensable for so many families.
Yeah, it is one of the sad and disturbing ironies of this crisis that doctors don't need special permission to prescribe opioids, but they do need special permission to prescribe the medication that would help people combat the disorder and get better.
And if I could just add, Senator, I think here the president's goal is to get it right.
Right.
We don't want to end up in court and delay it even further.
Right. I understand that. Let me turn to another issue. As you know, Senator Cassidy and I spent several years working with former Help Committee Chairman Alexander and current Chair Murray on bipartisan legislation to end the practice of surprise medical billing. It was a great example of the type of bipartisan work that can be accomplished in the Congress when we work together to find common sense solutions. Now that the surprise medical billing legislation has been signed into law, the responsibility to implement these protections will fall to the Department of Health and Human Services. So if confirmed, you're going to be responsible for implementing these policies quickly and in a manner that protects consumers and reflects congressional intent. If confirmed, will you commit to working with us on a bipartisan basis to ensure that 1 year from now, the rules issued by HHS include strong protections for consumers that reflect the priorities and intent of our legislation?
Senator, we got till 2020, the beginning of 2022 to get this done. I know this one's important to you and so many. Thank you for the work you did to succeed. I hope we are truly a partner with you on this, and I know that we got to get this arbitration provision right along with the consumer protection.
Well, thank you for that. I appreciate that commitment and look forward to working with you. Just one last thing. We're all grateful to the scientists and public health experts who worked so quickly to develop the Moderna and Pfizer vaccines. I believe in their effectiveness, but we also know that we are seeing the emergence of new COVID-19 variants, and that we're going to need to continue research and surveillance efforts so that we can continue to develop effective treatments and vaccines. So what steps do you believe we have to take to be prepared to respond to the emergence of these new variants and protect our vulnerable populations?
Senator, sequencing is so critical. We have to have the scientists tell us what the next iteration of that virus may look like. We have to stay ahead of the game because we're now with this vaccine getting a grip on COVID. But if a variant takes off, we don't want to go back to square one. And so we need to do the sequencing. We need to provide the scientists with what they need. We have to also rely on data. But we have a tremendous job to do to make sure we stay ahead of the variants.
Thank you very much. Thank you, Madam Chair.
Well, Senator